What it essentially is, it was a phase 1b/2 study, and we're talking mostly about the phase 2 data. We did present some of this at ASH in late last year, so ASH of 2015. And what it really is a combination of pomalidomide and dexamethasone with ricolinostat. Now, ricolinostat, if you think about HDAC inhibitors, it tends to be more selective for HDAC6. And because it's not a pan-HDAC inhibitor like some of those which have been tested in myeloma, like vorinostat and Pomalidomide, what we do believe is ricolinostat has less off-target toxicity. It's much better tolerated. So as you know, Pomalidomide is approved for the treatment of multiple myeloma in combination with bortezomib, and this is after about 2 lines of treatment. What we've done here using this HDAC 6 sort of selective inhibitor, it also has some HDAC 1, 2, and 3 activity. We've combined it with lenalidomide. The rationale for combining it was along with some of the HDAC 6 activity, it actually blocks transcription factors like c-Myc and IRF4 along the Icarus pathway, and along with that it augments apoptosis of myeloma cells, so you get increased caspase cleavage, increased PARP cleavage, and when you combine it with an IMiD, we see that this becomes more pronounced. So what we are going to be presenting data on, we've actually treated about 96 patients now in this phase 1b plus phase 2 study. We're going to be talking mostly about 66 patients, and these 66 patients, because they've received up to about 6 months of treatment, so we have follow-up on those patients. And what's really quite remarkable, and this is a patient population which is very similar to MM02 and MM03. If you remember, those were the studies which got POM-Dex approved, so very similar patient population. In fact, a little more heavily pre-treated. The average median number of lines of treatment with this was about 3, but as many as 7 lines of treatment, and the majority of these patients were refractory to whatever they were receiving prior to going on to the study. About 50% of these were refractory to lenalidomide. Quite a few were refractory to bortezomib and lenalidomide combination, refractory to carfilzomib, as well as very few, but had POM exposure. And what we saw here was an overall response rate of about 46% with the combination, which is certainly higher than what has been seen with POM-Dex. What was really quite striking was the duration of response and the progression-free survival in these patients to the tune of 7 months and 9 months. So that's again remarkable in this patient population. If you think about PFS in the POM-Dex studies, it was a little less than 4 months. With this, with all 96, so an unfiltered look at all patients, including the phase 1b and including those who haven't gotten 6 months of treatment, we've seen a PFS of about 7 months, so nearly a significant increase. I think what is striking also is the fact that patients stay on drug for a long time. So I have patients on for 18, 20 months and 20 plus months, which underscores the fact that this combination is quite well tolerated. We don't see the same toxicity that we saw with Pomalidomide in the way of diarrhea and other GI-related toxicity. Most of the toxicity we saw with this combination was very manageable, and it was more akin to a pomalidomide toxicity, so neutropenia, thrombocytopenia, and so on and so forth.